Good evening, ladies and gentlemen. We are starting this evening's program. Shall we please be on our feet as the speaker and the chair take the high table? I humbly ask that we put our mobile phones on silent. Thank you.
Good evening. You're welcome to this event. The President of the Ghana Academy of Arts and Sciences, the past presidents of the Academy, vice presidents, fellows of the Academy, honorable ministers, members of Parliament, Your Excellencies, distinguished guests, ladies and gentlemen. On behalf of the President and Fellows of the Ghana Academy of Arts and Sciences, I warmly welcome you all to this evening's event. As many of you are aware, the Academy's annual lecture in the Humanities and Sciences were instituted in 1993 as a platform for fellows and non-fellows of the Academy to share their thoughts with the Ghanaian populace on topical national issues. We are privileged this evening to have Professor de-Graft, Aikins, a fellow of the Academy, to deliver this year's annual lecture in the Humanities. At this stage, ladies and gentlemen, I wish to introduce the chairperson for this important occasion. Our chair for this evening's event is Professor Joseph Roland Achu-Ayi. Professor Achu-Ayi is the Vice President, the Arts Section of the Ghana Academy of Arts and Sciences, and he's been Vice President since January 2023. He held the positions of Rector, Deputy Vice Chancellor, Dean, and Head of Department in some higher education institutions. He was elected a Fellow of the Academy in 2005 and served as Assistant Honorary Secretary for the Arts Section between 2014 and 2015. He was also the Honorary Treasurer between 2016 and 2017. He was the occupant of the UNESCO United Nations University Leadership Academy Chair in Leadership Studies in the University of Jordan in 2001, and the Emeka Anwanko Visiting Chair of Commonwealth Studies, Institute of Commonwealth Studies, University of London in 2013. He served as a member of a team of experts that drafted Ghana's National Decentralization Policy Framework and Action Plan, and that was between 2015 and 2019, as well as the National Decentralization Policy and Strategy, and that was between 2020 and 2024. Professor Ayi has over 200 publications in several areas of political science, public policy, and administration. His latest publications include 3 co-edited books on think tanks in Africa, political institutions, and public sector management in Ghana, which are forthcoming this year. His current research interests include higher education management, politicians and bureaucrats relationship, political transitions, and democratic backsliding. Ladies and gentlemen, help me welcome the chair for this important occasion.
Thank you, Assistant Honorary Secretary, President of the Ghana Academy of Arts and Sciences, past and current Vice Presidents, Fellows of the Academy, my dear students, I understand that one of the schools will be joining us. They just finished writing the examination, so we are still expecting another batch of students. So distinguished guests, ladies and gentlemen, we are here to listen to an interesting lecture because it is about food. We all eat unless we are performing our religious obligations. Maybe we are fasting, or maybe we are being asked by the doctors to not to eat before a procedure is undertaken. And so where food is, we're all happy. And it is good that we have somebody who is prepared to talk to us about food, maybe its advantages and disadvantages. And the speaker is Professor de-Graft Aikins. She is a professor of social psychology at the Regional Institute for Population Studies, University of Ghana, and a visiting professor at the Department of Methodology, London School of Economics and Political Science, LSE. She received her PhD in social psychology from the LSE, completed postdoctoral training at the University of Cambridge, and has held teaching and research positions at the LSE, University of Cambridge, University College London, and University of Ghana. In July 2023, she completed a 4-year tenure as a British Academy Global Professor at the Institute of Advanced Studies, University College London. Professor de-Graft Aikins' research focuses on the social psychology of chronic illness and on the psychosocial drivers of chronic non-communicable disease (NCD) burden in continental and diaspora African settings. She also has a strong interest in arts in health, the history of psychology in Africa, and how both fields intersect with critical theory and African studies. Her research draws on critical psychology principles, applies qualitative and arts-based methods in community settings, and is often embedded in interdisciplinary transnational projects on chronic disease risks, experiences, and care. She is currently principal investigator on chronic disease risk, experiences, and care. She is currently principal investigator for the British Academy Seed funded Chronicity and Care in African Context project. The project examines how social responses to chronic conditions can shape public engagement and chronic care interventions in continental and diaspora African communities. She is strongly committed to capacity building in graduate research and has taught, supervised, mentored, and examined graduate students based in African, European, North American, and Australian universities on the social science aspects on Africa's NCD burden. Professor de-Graft Aikins has received prestigious awards and fellowships, including the Economic and Social Research Council ESRC Postdoctoral Fellowship 2005, Aspen Ideas Festival Scholar Award 2009, Inter-Academy Panel IAP Outstanding Young Scientist Award 2011, the LSE African Initiative Fellowship 2013, and the British Academy Global Professorship 2018. She was inducted as a Fellow of the Ghana Academy of Arts and Sciences in 2016. In 2019, she was elected as an international member of the U.S. National Academy of Medicine. Her topic is interesting, as I've said. Food is medicine. Food is poison. A social, psychological perspective on Ghana's public health nutrition crisis. Ladies and gentlemen, I present to you Professor de-Graft Aikins.
President of the Ghana Academy of Arts and Sciences, Vice President of the Academy, esteemed Chair, Prof. AYEE, Fellows of the Academy, distinguished guests, lovely students. It's an honor to present the Academy's 2024 annual lecture in the Humanities. I hope I do this honor justice. In 2006, Ghana's Ministry of Health, MOH, piloted an intervention called the Regenerative Health and Nutrition Program, which aimed to address the growing burden of nutrition-related chronic non-communicable diseases, NCDs. The program was a brainchild of the Minister of Health at the time, Major Retired Courage Kwashiga, and was developed in collaboration with the African Hebrew Development Agency, AHDA. The RHN program was piloted in 9 districts in the country's then 10 regions and applied slogans, signposts, the celebrity campaign, and reimagined recipes to amplify its core message, which was food is medicine. The program was a rare example of a participatory public health nutrition intervention in Ghana that was developed and funded by the MOH, did not involve a dominant donor partner such as USAID or DFID, and adapted a model of healthy eating, AHDA's Edenic divine diet, which I'll talk about later, that was little known in global public health, unlike the Mediterranean diet, for example. Finally, it was piloted at the community level across the country in order to develop proof of concept. On paper, the RHN project should have been successful and sustainable, but due to a complex blend of conceptual, logistical, and political factors, the pilot never matured into the national level intervention Major Kwashiga envisioned. The problem of nutrition-related NCDs has intensified in the years since the program ended, as have the conceptual, logistical, and political challenges in public health nutrition. In this lecture, thank you. In this lecture, I revisit the program through the lens of its creative methods and the local responses it evoked, and consider the lessons it presents for the social psychological dimensions of public health nutrition today. I define the social psychological dimensions in terms of the social representations of food cultures, the ways in which people in specific places think, feel, act, and produce practical social knowledge in relation to food, cooking, and eating. The lecture unfolds in 3 parts. In part 1, I'll describe how creative methods were used to promote the RHN core message of food as medicine. This brings the humanities to the fore, and this lecture is about the humanities. In part 2, I examine the scope and limits of the message and methods through the local responses the program elicited. While the program promoted food as medicine, It did so within a diseases of lifestyle framework for NCDs, and this framework places the risk in the domain of individual choices and behavior. This message clashed with the competing representation of food as poison that prevailed across the RHN communities and in farming, fishing, and mining communities across the country. This representation developed from what the scholar Davis calls slow observations made by communities about the slow violence of toxic agricultural practices and environmental degradation and food market globalization. And it also placed food cultures and nutritional risks in structural context. In part 3, I'll track the ways the slow violence of toxic agricultural practices, environmental degradation, and food market globalization, along with the creative marketing strategies of multinational food companies, and how these continue to undermine local food cultures, presenting significant challenges for public health nutrition. I'll close by reflecting on local and global examples to make a case for investing in creative and participatory interventions that center local food cultures. So, part 1, as I outlined earlier, I'm not sure how this works. Do I point it to you or, okay, thank you. So as I outlined earlier, the RHN program was a brainchild of the Minister of Health at the time, and he developed this in collaboration with the African Hebrew Development Agency. I want to tell you a little bit about this agency. It was established by the African Hebrew Israelite community, a community of African Americans who emigrated from the south side of Chicago in the US via Liberia to Dimona, Israel in the late 1960s. They lived holistic lifestyles and consumed a vegan diet trademarked as the Edenic Divine Diet. The Divine Diet had, according to the community, provided numerous benefits, including the virtual elimination of lifestyle diseases like cancer, heart disease, diabetes, and so on, which plague African American communities in the US today. While the community's advocacy work in the US and Israel had been well documented, their leadership on the RHN program in Ghana appeared to be the first time they had promoted their EDD model to an African country through their development agency. But from a development perspective, this unique project built on decades of African American development work in Ghana through the Nkoswohene, the Development Chief Initiative, established by the late Asante Hene Otumfuo Opokuwari in 1985 for Asante development, and supported by successive governments since. Major Kwashiga was a former military leader before he took on the position as Minister of Health, and he had met this community in Israel during an official visit years prior. Their origin story and holistic lifestyle had inspired him, and when Kwashiga was appointed health minister, there was a rising prevalence of chronic non-communicable diseases such as diabetes, hypertension, strokes, and so on. And a double burden of nutrition was a risk factor in these chronic conditions. This is a phenomenon whereby both overnutrition, which is eating high-calorie foods associated with overweight and obesity, and undernutrition, eating nutrient-deficient foods or experiencing grades of starvation associated with stunting and underweight, coexist and are often present in the same community, household, or individuals. Sometimes people are obese and you think, well, they're overeating, but actually they're not eating the right food. So they have a mix of overnutrition and undernutrition. Now, despite the establishment of a non-communicable disease control program in the late 1990s, minimal progress had been made on the prevention and care of chronic diseases because the program had been consistently understaffed and underfunded. Between 1990 and 2010, the top 25 causes of premature deaths in Ghana included protein, energy malnutrition, which occupy the top 10 position at both points of measurement, and 4 NCDs, stroke, diabetes, liver cancer, and chronic kidney disease. The risk factors for these conditions include overweight and obesity. For Kwashiga, the African Hebrew story, and in particular, the community's claim to disease-free longevity was just the innovative push that the Ghanaian public health and environment needed. The beginnings of a collaborative project was hatched then and fine-tuned through consultative meetings between AHDA representatives and local experts, health experts in Ghana. The RHN program was launched under a broad health policy theme, Our Health is Our Wealth. Thank you. And was piloted, as I said earlier, in 9 districts. In each district, a standard format was followed. Next slide, please. AHDA members run to you. Okay. Thank you. In each district, a standard format was followed. The African Hebrew members would run a 1-week workshop in a local community center. In the weeks preceding the workshop, participants were strategically selected to represent community members, community leaders, like markets, queens, religious leaders, healthcare providers, healthcare administrators, and political leaders. Workshop participants were called change agents, CAs. A training manual developed by AHDA and local experts was used in the sessions. It had 3 sections: healthy lifestyles, regenerative nutrition, and child and maternal health. The Edenic divine diet was at the heart of the regenerative nutrition section, and local recipes were reimagined through this frame. The language of meetings was English. RHN workshop meetings began and ended with motivational slogans: food is medicine, water is medicine. These slogans became RHN brands. Signposts erected outside district and community health centers provided visual reinforcement of the RHN messages. To scale the program up to national level, Ghanaian celebrities, creative artists, and media professionals were co-opted as RHN program advocates to share nutritional and health messages on television, radio, and in public spaces. Selected RHN advocates also traveled to what was called study tours to the village of Peace, Dimona, Israel, on the government's ticket to observe the holistic lifestyles of the African Hebrew community. Now, in June 2007, sorry, I'm trying to understand how this works. Yeah, okay. In June 2007, I was commissioned by the MOH to conduct an independent review of the RHN program. My task was to examine the impact of the program on acceptability and behavior change by interviewing selected CAs in all the pilot communities and observing their social practices and environments. I was invited to observe the final workshop, which was held in Big Ada in the Greater Accra region, a community whose development chief, Nene Okante I, was the late legendary African-American musician Isaac Hayes. Now, Isaac Hayes, Nana Okante had built a center called Necotech, which was supposed to support young people in the community who wanted to get into tech. As you can see, I'm not very technologically astute. And the meeting was held in this Necotech center. I sat through teaching sessions, joined the walk of life on the beach, and had the opportunity to speak to the AHDA leaders and key members about their life philosophy and their goals for the program. Following the Big Ada experience, I spent 2 weeks in the field with 3 research assistants. We were given 2 days by the Ministry of Health to gather data in each community. So we applied what's called a rapid appraisal method, combining interviews with observations and situated conversations within a social psychological framework. We visited primary schools and talked to school children in Amasaman and Isikuma. We engaged with one church community congregation in Tamale. We visited a traditional birth attendant in Ho. In each community, we conducted basic food surveys in one selected market. Can we go to the photo, please? It's not working, unfortunately. Thank you. In each community, we conducted basic food surveys in one selected market and ate in local restaurants. Next slide, please. In Akemoda and Keta, we were invited into the homes of CAs for home-cooked regenerative meals. Next slide, please. We visited health centers in all the communities, a CHIPS compound in Amasaman, and talked to district directors of health services, district directors of nursing services and DCEs, and professionals within GHS and local government. In all, we interviewed 156 CAs and engaged with just over 100 people who were not CAs across the participating communities. Later that year, Sorry about the interruptions. So we interviewed 156 CAs, engaged with just over 100 people who were not CAs across the participating communities. Later that year, I submitted a report to the Ministry of Health and presented key findings at a meeting convened in Ho by the Minister. Now I'm going to move on to part 2. I hope this works. The food gods are trying to jinx me today, but it's not going to happen. So I'll move on to part 2, and I'll talk about the scope and limits of this program. What worked, what didn't work. So the core RHN message was food as medicine, and it was two-pronged. Eat more locally grown fruits and vegetables, and avoid processed foods. This dual message was emphasized during the workshops. So participants were told, eat locally produced brown rice instead of imported white rice. Cook with local spices such as black peppercorns and basil instead of cubes like Nestle's Maggi cubes and Unilever's Royco cubes. Drink teas made from local herbs such as moringa instead of instant coffee with tinned milk. There was also a major emphasis on cutting back on meat and eating more soya protein and tofu. This message was promoted, as I outlined earlier, through slogans and signposts, a celebrity campaign, and traditional recipes reimagined through the Edenic divine diet. So what worked? The slogans and the signposts worked for a number of reasons. So, as you all know, verbal and written slogans are ubiquitous in Ghanaian social life. You're driving along the road, you see lots of signposts and all sorts of, flyers, fly posters pinned on trees, on hoardings, and so on. Now, Atu Kwesen, the literary scholar, in his book Oxford Street, describes Oxford Street, our iconic commercial street in Accra, as an archive upon which a veritable galaxy of mottos and slogans on lorries, cars, pushcarts, and other surfaces are frequently to be encountered. Mottos and slogans, Kwesen observes, are, and I quote, a distinctive feature of Accra and many African urban environments. They extend from a domain of oral performativity and reach into the domain of writing, such that the process of reading them requires an innovative understanding of their mixed genres and the orality literacy spectrum from which they draw their meanings. End quote. The RHN project built on this social practice to some measurable effect. In Big Ada, lessons were punctuated with call and response interludes. Instructors would call out regenerative health, and workshop participants would respond, renew your strength, prevent disease. These slogans were reproduced on signposts along with other core RHN messages. Oops. All right. Should we go to the slide that has the signpost, please? Yeah. So these slogans were reproduced on signposts along with other core RHN messages, including, eat more locally grown staples, drink water, engage in physical activity, and avoid processed foods. The RHN signpost had a simple text-based design, a branded logo of 3 figures with raised hands in red, yellow, green, and black, colors chosen to reflect the colors of Ghana's flag. And was, below this, text in blue and red were crammed onto a white background. Some of the signposts added blocks of color to accentuate the texts, others did not. For example, the signpost I'm showing here was outside the premises of Hohoe District Hospital in the Volta region. The core dietary messages were remembered months after the initial RHN workshops. In communities where RHN clubs had been established and met regularly, such as in Wa, the ritual of starting meetings and punctuating sessions with the slogans amplified the message for club members. Some CAs had shared the core RHN message with family members and significant others who did not participate in the workshops. The signposts placed outside selected local clinics and district hospitals reinforced the core messages of RHN for community members who use these facilities. Although workshop participants were selected based on English language proficiency, a few participants criticized the over-reliance on English language as a dominant language of instruction during the workshop and for branded project activity. We'll come back to why this is a problem. There was a celebrity campaign. The RHN program tried to adapt lessons from previous campaigns such as Stop AIDS, Love Life, which was used for HIV/AIDS prevention. They tried to involve celebrities in the application of RHN messages. For a period, they tried to sign on Jedouble Ambule. I hope the young people know Jedouble Ambule. Ghana's high life icon, and he's a long-time vegan, which is why they wanted him. He spoke once at a food fair held at the premises of the MOH headquarters in Accra. There were no follow-up activities after this. Few CAs mentioned celebrities associated with RHN, and they didn't because the campaigns did not appear to have had an impact. They were based largely in Accra, and so didn't spread out beyond the capital. Apart from one radio DJ, Abeku Santana, who would often sort of talk about regenerative health on his programs, none of the advocates who had gone on these study tours to Israel appear to have paid their end of the bargain after they returned from their trips. Indeed, in Accra, a lot of the research and policy community people perceived the Dimona study tour as a project of patronage, which privileged public figures with close relationships to the minister and his team. What didn't work? Reimagining, next slide please. Reimagining traditional recipes through the Edenic divine diet did not work. At the core of the program, as I said, there were these new recipes. At the workshops, there were cooking demonstrations that focused on recreating local recipes and meals with healthier ingredients, healthier ways of cooking, steaming instead of deep frying, for example, the use of soya protein and tofu as meat substitutes. These recipes were also set as cookery homework for participants. Ingredients for these new fortified Ghanaian recipes were provided in an appendix to the training manual with a message: prepare these dishes according to local traditions without meat and enjoy the taste, exclamation mark. The recipes included palm nut soup and fufu with baked tofu, apim and greens with tofu or agushi, banku and fresh pepper with battered tofu or roast, and okra sauce baked with tofu or gluten. I want you to imagine how that would taste. Okay. The new recipes had a mixed impact. the active adoption of regenerative meals occurred in a small group of women. In Tamale, Wa, Akemoda, Keta, and Ada, CAs reported adding soya protein to stews and soups. In Keta, CAs cooked brown rice occasionally. In Akemoda and Ada, CAs avoided cubes and other artificial spices and incorporated local spices in their dishes. In Amasaman, Hohoi, Keta, and Ada, moringa had become a herb of choice for teas and as food seasoning. In these districts, some CAs had even planted moringa trees in their gardens. I don't know if any of you did that, but there was a time when moringa was a huge thing. Before that, it was, what was it? It was cocoa, I think it was. In Akemoda, some women cooked and sold regenerative meals and snacks for profit of official district health committee events. There were challenges to adopting regenerative nutrition diets. Most CAs noted that insufficient time was allocated to demonstration sessions to enable them to gain practical experience to make new things like soya milk and soya kebabs. Secondly, the basic ingredients required to make these products were either unavailable or very expensive. The CA who served us a tofu-based tomato stew with local brown rice and Kate, I showed the photo earlier, did not cook this meal often. I mean, she did it for us because we're visiting. Because, the cost was prohibitive and making tofu from scratch was time-consuming. The new recipes did not catch on beyond the small group of CAs because the program did not factor in the complexity of local cuisines and food cultures. The program also ignored a shared concern about the toxicity of staple foods and the encroaching power of cheaper imported processed foods. And I'll take each challenge in turn. And I'll go in a little bit of a detour, but please stay with me. In food studies, recipes have been described as culinary texts or living transcripts of daily cooking. The cooking process itself is seen as an art form. Recipes and cooking provide insights into continuities and change in local cuisines. Rosomari and colleagues list 4 intersecting characteristics of the cuisine concept. They say we have to consider basic food or primary edibles, the tomatoes, onions, and so on. Distinct techniques of preparing food, frying, boiling, steaming, etc. Distinct flavor principle. And we can maybe use mamone as an example. Some people love it or they loathe it. A set of manners and code of etiquette. Are we eating together from the same bowl? Are we setting a table? I'll discuss these ideas through one traditional recipe that was targeted for culinary reimagination by the Arichan experts, palm nut soup and fufu. Now, there's this popular saying attributed to Asante communities that is captured in an interview between Fran Osiosari, who is an American food studies scholar, and the Ghanaian cookbook author, Diana Ayensu. She's apparently the first person to have authored a Ghanaian cookbook in 1972 for a foreign readership. So Diana Ayensu says, there are people who will say they haven't eaten the whole day simply because they haven't had their soup and fufu. If you give them anything, sandwiches, Caesar salad, they don't consider it as food until they've sat down with their bowl of fufu and soup, end quote. In Onions Are My Husband, an anthropological study of market women in Kumasi, American anthropologist Gracia Clark described the way Asante market women built their work routines, including the hiring of assistants and organization of childcare around preparation of fufu and soup. And they called it the only completely satisfying food. We all know what fufu is, so I'm not going to describe it. But Clark says there's an art to the preparation, right? She says pounding fufu requires strength and coordination. Turn the lump in rhythm between, this is an outsider describing how we make fufu, by the way. We turn the lump in rhythm between each stroke of the pestle, reaching each family member's preferred soft or hard consistency. Some people like their fufu hard, some like it soft. I lie? Okay, all right. No? Some people like it, in between. All right. Now, palm nut soup and fufu, palm nut soup in particular, is a major meal not only for Asante communities, but also for other Akan groups. The meal appears in folk tales, children's songs like You all know Pete Pete. Now I'm talking to the young people in the room. Do you know the song Pete Pete? No? Really? Thank you. That song. Can we get to the Fufu and Abenkwang bit? All right. So, where was I? Children's songs, popular music. Palm nut soup on its own has ritual significance for several ethnic groups. It's a soup of choice for lactating mothers because it's believed that it improves breast milk production. The GAAS use palm nut soup in Pukwe to memorialize ancestors and propitiate the gods during the Gahomawo festival. The core ingredients of the soup, as I hope we all know, are tomatoes, onions, peppers, chili peppers, palm fruit, meat, fish, shellfish. Salt, spices, vegetables like okra, garden eggs, mushrooms can be added for taste or as a garnish or accompaniment. These ingredients in the cooking process differ slightly across ethnic groups. As food systems have changed at home and Ghanaians living abroad have improvised with new ingredients, further culinary adjustments have been made. So busy cooks will use processed cans of, cream of palm fruit instead of preparing from scratch, which is a laborious process. Canned plum tomatoes can replace fresh tomatoes. In wealthy homes, tomatoes, vegetables, chilies, spices can be blended in food processors instead of stone grinders or earthenware grinding pots. The fufu itself can be prepared from processed plantain, cassava, yam flour. We blend it with water, bring it to the boil, knead it, into the fufu that we want. Cooking what Ghanaians call neat fufu reduces preparation time and removes the need for a cook's assistant. In Zoe's Ghana kitchen, the British Ghanaian chef Zoe Ajono speaks for the younger urban and diaspora Ghanaian generation when she exclaims, and I quote, "The strength and stamina required to make fufu from scratch could put it into an Olympic sporting category. If you ever get the chance, I do recommend having a go, but all hail packet fufu for a simpler life." I think some of us will agree with that, end quote. In the RHN updated recipe, the fufu making process remained the same. You can't do much with, plantain, cassava, and so on. But the preparation of soup was modified. Instead of meat and fish added at the early stages of cooking, baked tofu was to be added at the end of the cooking process. Extra time had to be allocated to make the tofu, and the nature of soups meant one had to be very careful, with texture. One can argue that adding tofu or some other non-meat ingredients is an acceptable culinary innovation because it involves adding a processed food ingredient in the same way that we use cans of creamed palm fruit or we use canned tomatoes and so on. But it's innovation towards a culinary cul-de-sac, I would argue, because cooking palm nut soup is lengthy, laborious, but the process is multi-sensory, right? Each stage releases layers of, smells of spices, steamed meats, fish, overtones of the palm fruit as the ingredients cook through, learning how to make palm soup correctly with all the ingredients cooked in the correct way. It's a rite of passage for young Ghanaian girls, and I'm hoping in the future young Ghanaian boys too. While the recipe differs across ethnic groups, and for Ghanaian communities abroad, core aspects remain the same. Meat and fish lie at the heart of an authentic palm nut soup. This is what gives the soup its signature taste and flavor. So adding tofu does not only change the core identity of the soup, it also changes the cuisine itself. The smells change, there's a marked difference in touch and taste. Culturally, therefore, the idea of baked tofu replacing meat in palm nut soup would be unimaginable in a Ghanaian household, whether Asante or not, for whoever cooks or eats the dish. For the majority of the RHNCAs, this was one reason for shunning the tofu-based recipes. Giving up meat will not happen in Ghana, they asserted, or Ghanaians love their meat too much. These were some of the popular opinions. The second reason closely was associated with the first. For people who ate their meals in public places, such as chop bars, where all eyes and ears are trained on the loudly transacted ordering process, one risked being labeled poor by ordering soup without meat. Many did not want the stigma of a diminished social status and explicitly sought to avoid it. Next slide, please. So one young man in Isikuma recounted his experience in a chop bar, saying people buy fufu with too much meat and think it shows wealth. Meanwhile, they don't know they're reducing their age. Sometimes I tell them that what you're eating is not good. My own is good, but they would laugh at me. His friend, who was standing next to him, said very clearly, nobody wants to be called a miser. And in addition to the problem of unavailable and expensive regenerative food ingredients, participants also expressed grave concerns about the impact of toxic agricultural practices and environmental degradation on staple foods. CAs in most districts expressed misgivings about eating fresh vegetables and fruit because of fears of contamination. Next slide, please. So one young female community nurse who we interviewed said, the bananas they're selling here, if you eat it, it's like you've taken pills in your mouth, as if they've forced it to ripen. Now, they're spraying them to us, we're afraid of we're afraid of the chemicals in the vegetables, the okra, garden eggs, even the pepper. So during the workshop, some of us asked that question, that they would like to take the fruit, but what would happen to them because they're using a lot of chemicals? Ultra-processed, unhealthy foods were abundant, often cheaper, and aggressively advertised in all the RHN recipient communities. This complicated the problem of inaccessible, expensive, and unsafe local staples. Next slide, please. The problem was highlighted very clearly in our encounter with food hawkers at a local health center in Amasaman. The hawkers, who had paused to rest outside an RHN signpost, quite ironic, were selling the kinds of processed common daytime snacks that the program sought to prohibit. White breads baked by local bakeries, yogurt produced by Fan Mill Ghana Limited, margarine, mayonnaise, and corned beef produced by multinational food companies. The concerns expressed by RHN participants were not new at the time. Representations of toxic nutrition had been circulating public spaces around the country and amplified in mass media headlines and narratives for years prior to the RHN program. Across the country, and particularly in farming, fishing, and mining communities, people spoke of changing diets and linked the changes to the twin challenges of toxic staples and processed foods. Lay perceptions of toxic nutrition were backed by scientific studies that reported high levels of toxic chemicals in agricultural produce, as well as rising levels of food adulteration with toxic chemicals. The concept of slow violence was advanced by American literary scholar Rob Dixon, and he defined it as slowly unfolding environmental catastrophes that are dispersed across time and space, and attritional violence that's typically not viewed as violence at all. British geographer Tom Davis extends this concept, arguing that local communities living with environmental catastrophes see through what he calls slow observations and live and suffer the material effects of slow violence. And he says, I quote, "For those who live in the midst of toxic geographies and polluted landscapes, everyday exposure to the accumulations of slow violence is not necessarily a formless threat, something that's not seen, but can be a very real and often tangible brutality," end quote. Second, Davis argues that slow violence occurs within a broader system of structural violence and epistemic violence. He defines structural violence as suffering caused through denial of basic needs when human beings are being influenced so their actual somatic, bodily, and mental realizations are below their potential. And he defines epistemic violence as non-formal expertise being ignored, where ways of knowing the world and knowing the self are trivialized and invalidated by Western scientists and experts, end quote. The intersection of structural, epistemic, and slow violence was evident in the accounts of RHN participants and the broader lay and scientific accounts. In this context, it's important to note that the trivialization and invalidation of local knowledge occurred as much through government inaction as through the influence of the country's donor partner system on policy making. During the evaluation phase, it was clear that slogans, and eat more locally grown foods and vegetables, avoid fatty, sugary and salty foods to prevent diseases, were simplistic and problematic. Repeating the slogans did not translate into adopting corresponding RHN recipes for healthier meals, for example. People did want to eat their local staples, especially when daily traditional meals like fufu and palm nut soup, whether cooked at home or consumed out of home, required staple produce. They also wanted to eat more healthily by reducing foods with high sugar, fat, and salt content. But the twin challenges of food toxicity and cheaper ultra-processed alternatives undermined this desire and thwarted attempts at behavior change. Next slide, please. Next slide. Thank you. So I'll move on to the third and final part. Food is poison. And I'm going to talk about food as poison, through, big food, multinational companies, advertising, and so on. So big food is a label given to the multinational food and beverage companies with huge and concentrated marketing power, who are often blamed for the rising prevalence of nutrition-related NCDs in low and middle-income countries like Ghana. In Ghana, big food companies like Unilever and Nestle established a presence in the colonial era and have, over the decades, built a formidable national infrastructure for tracking household habits and marketing their food products. National companies like Papaya and A1 Bakery, which started local and expanded countrywide, emerged in the 1990s. In the 2000s, global fast food companies like KFC and Pizza Hut entered the local market. Big food marketing builds on glocalization. This is the intersection of the global and the local. Built on glocalization principles by creating products and services of global markets that are adapted to local cultures. And the adaptation is done largely through creative methods. So advertising copy executives for these companies understand that food, cooking, and eating are multisensory processes, and they also understand that cuisines shape social identities. So billboards, radio, and television adverts fronted by local celebrities do not only sell processed products across the major food groups, fruit, vegetables, starches, dairy, protein. They don't only, sell these products that are produced to manipulate taste buds and cravings at the cellular level. It's a process called hyperpalatability. They also sell lifestyle and upward mobility, enhancing the cultural imperative to look good, successful, and wealthy in public. In a sense, it's a direct opposite of ordering a meat-free meal at a chop bar. So advertising executives use slogans, mottos, signposts to great effect. Local languages and popular terms are central to this strategy. Next slide, please. So a Pepsi poster in Gamashi, for example, designed for the Homoa season, uses GAA text. I'm not going to try and say it in GAA, because I'm not GAA. If somebody can speak it, maybe they can read it out for us. We can't hear you. Thank you. Which is, I hope this is right, Homoa season's greetings, right? Pepsi brings to all GAA people glorious end-of-year greetings. Am I right? At least that's what I was told it was. Okay. Next slide, please. A KFC billboard on the major George Walker Bush Highway. Maybe I should have just given you a whole lecture on billboards. You would have loved that. Uses feely feely, as you all know. Pidgin English for see for yourself, feel for yourself, right? The billboard, which actually you're driving down the road, it towers over the office buildings, and it reinforces its words with a giant cutout of chicken drumsticks, as you can see, cascading from a KFC bucket. Next slide, please. An Indomie billboard, as you can see there, as imposing as the KFC billboard, and situated on the opposite side of George Walker Bush Highway, introduces a new beef flavor. Indomie, an instant noodle imported from Indonesia, is an extraordinary marketing phenomenon in Ghana and across the African continent. Introduced to the Ghanaian market in 2006, the hyper-palatable product, which is packed with salt and additives, was quickly absorbed into the category of national street foods and is so beloved of children and youth, like yours truly in this room, that Ghana's Gen Z demographic is called the Indomie generation. Yeah. So across the continent, its popularity is captured in hit songs and meals served in television dramas. Now, recent big food investments in television cookery shows hosted by local celebrities bring all the powerful arts-based marketing elements together. The award-winning show is Iban. The Iban food show. Has anybody watched it? I guess not. No? Yes? Some people. Okay. Is broadcast on the TV3 television network. The show's host, comedian, actor, aspiring politician Kwame Jokoto, travels around the country, visiting local chop bars and restaurants and showcasing traditional cuisines to a national audience. Nanama McBrown's show, McBrown's Kitchen, is broadcast on UTV and hosted by her. Each episode features a local or international celebrity who talks about and cooks their favorite meal, assisted by McBrown. Jokoto's fancy slogan is Bana Melezizi. Illustrates the way both shows emphasize the pleasures of food and eating. You made me miss my place on the thing. Both shows are sponsored by food and luxury goods companies. Both are advertised on billboards, radio, television, and social media. Episodes are posted on social media accounts of TV3, UTV, and the hosts, collectively reaching over 1 million followers at any given time. These programs, alongside other forms of big food advertising, coalesce into a powerful, multi-layered communication tool. The tool demonstrates that marketing food through culturally grounded arts that mimic taste, memory, imagination, language, sociality, and tradition is spectacularly effective for changing food practices for communities, households, and individuals. So why is the RHN, I started this whole journey by talking about the RHN program, which is quite old. Why is it relevant for dealing with Ghana's public health nutrition crisis? And this is where I will start wrapping up. Next slide, please. The RHN program was well-meaning, but conceptually flawed, like quite a number of public health nutrition interventions. It applied an instrumental participation approach by imposing the Edenic divine diet on local communities without conducting a meaningful analysis of local food cultures or the wider food system. The art forms use an RHN messaging, if you think about it, which work powerfully in big food advertising. Slogans, celebrity campaigns, tweaking recipes, essentially tweaking food, were superficially applied. Local collaborative experts from the MOH worked with the concept of lifestyle diseases. This concept situated the risk of nutrition-related chronic diseases within individual behavior, when the double burden of malnutrition then and now is driven chiefly by commercial and environmental determinants. Crucially, for RHN communities and communities elsewhere, then and now, these intersecting harms are also changing the social psychology of food hybridization. Historically, Ghana's food system has been hybrid. Cuisines have evolved constantly through active borrowing and experimentations with ingredients, as well as cooking and preservation techniques. Social historians observe that Ga women were selling ready-to-eat food on the street in the pre-colonial era, predating the modern fast food phenomenon in America, Europe, and parts of Africa. In a 1978 survey of market women in Accra, American historian Claire Robertson detailed 6 categories of ready-to-eat foods, the preparation of which incorporated local and imported ingredients. Kenke, as we all know, complete foods like fufu and soup sold in chop bars, porridge, fried snacks like kose, baked foods, and maize wine. The local fast food industry of chop bars, check joints, and other forms of street food vending evolved from these Ga women pioneers and preceded the current dominance of big food. The Ghanaian food landscape has evolved over centuries through globalization. The Canadian-based geographer Joseph Mensah defines globalization as the cultural and I quote, the cultural interpenetration that occurs when powerful top-down globalizing forces encounter bottom-up processes of localization, end quote. The encounter, he argues, is dialectical. The global and local intersect in interdependent and mutually influential ways and lead to hybrid products or identities. When Ga women reinvented new cuisines, they borrowed in deliberate ways. Their curiosity led them to seek new foods and modes of cooking, and they seized opportunities afforded to coastal communities through frequent encounters with Europeans and European foods and cuisines. These global encounters were shaped by interconnectedness, mutual interdependence, and agency. Borrowings were two-way affairs, and emerging Ga cuisines included both global and translocal elements. Now, reworking cuisines is no longer about active borrowing or experimentation. Increasingly, our food cultures are changing through to resituate Mensah's argument, the imposition of powerful top-down globalizing forces that stifle the agency and creativity of bottom-up processes of localization. Next slide, please. In a photo-voice study, conducted a decade after the RHN program, Nyansechi Frimpong and colleagues examined perceptions of food security and nutritional health in a farming and artisanal mining community in the East Akem district. One participant observed, sorry, the text is not showing properly, I'll just read it out. He said, with galamsey and its impact on smallholder farming, we're in an interesting time. We've entered a time where fresh fruits and vegetables are highly expensive, more expensive than processed food options. So most sellers now give you the option. Either you pay more if you want fresh tomatoes, or you pay less if you want the processed canned equivalent. The photo, and he showed a photo of a market stall, with tomatoes, being sold, tinned tomatoes and fresh tomatoes. This photo, which I took from our local market, illustrates these options. One other contradiction is that it's even risky to eat the fresh farm produce due to the mercury deposits on the land. So now, we've all turned to eating processed foods. You'll recall that when I talked about the RHN evaluation, there was one community nurse who said precisely the same thing about bananas, and that was in 2007. In Gamashi, where I've conducted participatory action research with adults and children affected by chronic non-communicable diseases over the last decade, community members know their food. They know what they enjoy, they know what's healthy, they know what's not healthy, and even with cooking methods. But they live in an obesogenic environment. Next slide, please. Next slide. Thank you. But they live in an obesogenic environment overlaid with elements of toxic nutrition which shape their food and dietary behaviors. All the red dots you see on that map are all the places where unhealthy foods are sold, and you can see that the red dots outnumber the green and the amber dots. Can you see? Yeah, so if you live in an environment like that, you certainly can't exercise individual agency. You're kind of crowded out by environmental sort of dynamics. Next slide, please. So I'll give a few examples of what they say, which show you that they know what to do about eating healthily, having sort of healthy lifestyles and so on, but environmental factors, prevent them from doing so. So one middle-aged woman, and these are interviews I did with people living with diabetes, hypertension, stroke, etc. One middle-aged woman says, oil that settles off when placed down can give you the illness, diabetes, as well as eating of rich stuff. Someone would want to pour a whole tin of milk into the gari and add a lot of sugar too. It can give you diabetes. When vegetables and oil meet in your stomach, it can give you diabetes. I think that's a really great quote. Another man, older man, stroke survivor, says, when you're drinking alcohol and smoking and a lot of things, you can get stroke. So again, they know what the doctors say, they know what the nutritionists say. A third woman says, third person, a woman says, they use chemicals to grow and forcefully cause the vegetables to ripen by using chemicals. The chemical foods is our problem now, causing all kinds of sicknesses. And the last person says, you see, the fact is they may ask me to, let's say, eat meat, and perhaps I cannot buy fish for myself and meat for my whole family. So what they take is what I take. You see, now in Ghana, you take what you get to eat and not what you're supposed to eat. I'll end with some food for thoughts, and this is pun clearly intended. Next slide, please. There's clearly a violent interplay of expanding global forces and diminishing local choices where food systems and cultures are concerned. This is what nutrition interventions are up against and must contend with, whatever methods they use, to communicate, healthy eating and healthy diets and so on. We have to ask some questions, though, in terms of how we move from knowing what the problems are in our everyday lives and formulating solutions that work over time in sustained ways. First of all, what's the policy on big food marketing strategies? The big food marketing strategies combine science and art. So they know how to produce food that is tasty, delicious, addictive. People are buying KFC buckets that cost 50 cedis and 70 cedis. And what is the minimum daily wage in Ghana? Oh, you're a finance person. What's the minimum daily wage? How much? 18 cedis, right. So 18 cedis per day, but people are buying 40 cedis, 50 cedis buckets of KFC. What do? Do we police big food marketing? Do we reject it? Do we co-opt what they're doing in our models? For example, via edutainment, the food shows are brilliant, they're fun, you enjoy it, you laugh, and all those sorts of things that make you stop and think and maybe try and change your behavior. Can Ministry of Health, Ghana Health Service really fight the might of Unilever and Nestle, who've sold food and household products in Ghana since the colonial era, before I was born? And I'm not going to talk about my age. The second question is, how do we incorporate local knowledge into policy and practice on food and dietary interventions? All lay communities have their local cuisines. Many are hybrid, which means people are open to the new. People also know what they love and hate in terms of food. Food cultures are central to social life. And all of these are older and far more powerful than nutritional sciences, which really are just about 100 years old, actually. And any policies that may arise from these disciplines. Third question is, how do we make the food nutrition research field more interdisciplinary and more people-centered? There's important work happening in public health at present with funded projects at the School of Public Health at University of Ghana, for example, working across sectors, including government agencies like the Food and Drugs Authority, to label foods and address poor marketing practices. But a lot of these projects are firmly embedded within biomedical and biological sciences models. The detour that I made via palm nut soup and fufu was deliberate. I was trying to illustrate the importance of an interdisciplinary approach, because the story moved beyond discrete food ingredients, tomatoes, onions, salt, pepper, and so on, to the broader cultural system of cooking and eating. And I couldn't have told the story without applying an interdisciplinary lens, learning from anthropologists, historians, geographers, and so on. What can the social sciences, for example, social psychology, or the humanities, anthropology, history, arts, offer this field in Ghana, and how can interdisciplinary models be developed and sustained? I mean, these are questions that are being grappled with in public health nutrition in countries like the UK and US, South Africa and Kenya, where the NCD and obesity crisis are seen to be fueled by big food, and there's a recognition that there's a lack of adequate research and intervention models. And I hope this lecture has given us some food for thought, thinking about what we're eating, where our food comes from, how we're innovating in cooking and cuisine generally, and what we can do to move this into the research space to create better models for public health nutrition. Thank you very much.
Thank you very much, Professor Amma de-Graft Aikins. Please, another round of applause for her. As I sat down and I was listening to her, she mentioned a lot of things. And as a student of policy, I have about 3 or 4 takeaways. One, that the policy on, or the program on regenerative health and nutrition was started and owned by the Ministry of Health in 2006, piloted across, some areas, of the country. What has been the state of regenerative health and nutrition program? What has been its state? We have a policy champion, Major Courage Kwashiga, who unfortunately moved from agriculture to health, and then, of course, with the transition, in government, that was it. So in terms of policy continuity, we had a problem with the program. And I think that as a country, we need to look at how good is the policy, irrespective of the government in power. We should continue with that policy. Honestly, I have not heard of this program since he left office, since Major Courage Kwashiga left office. I knew about it long ago. But even though we all agreed that this program was going to reduce the non-communicable diseases in Ghana, now if a Google search will tell you that non-communicable diseases have actually increased. We have ages between 30, 40 having non-communicable diseases. So what I'm trying to say is that, one, we need to get our policies and programs right and continue with them irrespective of the government in power. I think that's very important. Policy discontinuity has been the bane of Ghana since independence. We need to do away with that. The second issue that was raised is the Ghanaian cuisine. That our recipes are very important. And whether we like it or not, Ghanaian foods are much, much healthier than, the foreign ones. I mean, the example, brown rice, paddy rice, beans, what have you, all those things. But now we are looking for long grain rice, right? Long grain rice, and I don't know how that would, help us. So we need more education. I think that Ghanaians will have to undergo orientation as far as food is concerned. The local foods are better than the foreign ones, and it has improved all along, right? So we need to look at that. Even though I agree that there has been a globalization of the food market. She mentioned KFC, Papaya and others. There are others. A lot of them are springing up, in Ghana. So the globalization of food will have to be looked at. Which way do we go? I think it should be a government policy on that. Of course, the government has made the point that it's not going to import rice. I mean, that policy has been on. Every government which comes to power, we need to reduce rice importation. But we have not gone far. Again, the issue of how do we deal with our policies. The third issue, which to me is also very important, is that whether we like it or not, Ghanaian foods are very expensive. If you want to go and buy cucumber, if you want to go and buy lettuce, if you want to go and buy brown rice, and they are very expensive. How do you get around the expensive nature of Ghanaian foods, in spite of the fact that they are more nutritious than the foreign ones? We need to get around that. And the argument is that more Ghanaians are now shifting to local foods because they think that they are much healthier than the foreign ones. So it's a question of we need to grow more in order for Ghanaians to enjoy. It's a very important issue. I've also, sitting down there, she made a point about chop bar and restaurant. Which one do we go? It's a very controversial issue. Some people have said that if you go to the chop bar, you have lowered yourself. You go to the restaurant, even though the food at the restaurant may not be as good as the one at the chop bar, or the preparation of the food at the chop bar may not be as good as one would have expected at the restaurant. We also need to look at that. And the final point, the crisis, the real crisis. Food is good, food is medicine, but food is also poisonous. And she made the point about the toxic rates of agriculture in Ghana. I think she also made the point that chemicals are used on oranges, bananas, pawpaws, and the rest to make them ripe as quickly as possible for the sellers to actually sell. All that. So we also need, back to galamsey, back to the chemicals that we use, we need a proper national orientation and education on food items. Otherwise, the non-communicable diseases will continue to be problematic, for us. On that note, I would like to thank the speaker again for that. I think I've done my job as chair. I'll now call on the assistant honorary, secretary for announcement. Thanks.
I think we should also give it up for the chair. And he summarized the issues so well. I would have loved to sit in your public admin class. Amma, thank you very much for that insightful lecture. I think it was so insightful and very practical. And she broke down the issues, and I think we all enjoyed it. Thank you very much. I want to acknowledge the support of DigiBooks Publishing, University of Ghana, and Partnership for African Social and Governance Research. If they are here, maybe they can give us a wave for supporting this lecture. We want to acknowledge the presence of Achimota. Is that Achimota School? Okay. Thank you for coming. Yeah, and thank you all for coming. My former vice chancellors are here, and I'm humbled. All right, so just some housekeeping issues. So we have an upcoming event for this month. We have on the 16th of May, Professor Kofi Ejekum, a fellow of the Academy, will be delivering the Ephraim Amu Memorial Lecture on the theme, The Significance of Ephraim Amu's Defiance of Cultural Imperialism. And this is happening at 5:30 on the 16th of May in this same auditorium. So please, let's come and support Prof in this lecture. And then on the 20th of May, 2024, also at 5:30 p.m., we'll have Professor Samuel J.C. Obeng, a fellow of the Academy, who will be delivering his inaugural lecture on the theme, Language and Liberty of the Ghanaian Political Discourse. And then the third one will be delivered, it's also an inaugural lecture, will be delivered on the 30th of May, 2024, at 5:30 p.m. by Professor Kwesi Ampene, also a fellow of the Academy, and his topic is on the performing petition, Kete songs, lineage and kinship in Akan. So I encourage all of us to come in numbers and support the lecturers in these lecture series. Thank you very much for coming, and let me also acknowledge the presence of our Vice President in charge of the Sciences section. Prof, you're welcome. All right, so thank you very much once again. Refreshment is served, so don't rush away. Just stay and then interact with others. Thank you very much.